So my mother came in unresponsive and she had a stroke.
Hi, good morning.
So it's learning how to get past that obstacle of telling her to drop her pride. Be accepting to the fact I have to rely on these people to help me and let that guard down. So she's very comfortable with her because you hear her talking to her. She doesn't do that with everybody.
For Kimberly, Lana Wilhelm at her mom's bedside is a blessing. But Lana is also there for her.
Just a lot of information, a lot of people telling you things to do things, and you don't know where to turn.
You don't know what's going to happen from day to day, but there's support there for you, which there hasn't been in the St. Louis area, really in the country, for caregivers. There's a ton of support for stroke patients themselves, which is wonderful, but the caregivers have nothing.
That's the change and the opportunity Lana is bringing about at Mercy Hospital St. Louis. Lana checks in a couple days a week as a family stroke care volunteer. She went through this herself with her husband's stroke and long recovery. Even having a background as a registered nurse, it was still so overwhelming from the hospital to the home that she wrote a book about it. It's now sold in the gift shop at Mercy Hospital St. Louis. Kimberly is also in healthcare. Her background is pharmaceuticals, and suddenly she's unprepared.
You know, that was the shock that I went through. I remember being in the emergency room and thinking, oh, I'm a nurse. I should be able to handle this. But at that point, my medical knowledge, my nursing went right out the window.
I have a history, a background in neuroscience. I would be the perfect person to be the spouse of a stroke patient. Not true. When you walk into that room, when your husband or wife has a stroke, you are no longer a health professional. You are a deer in the headlights.
This is where the building blocks for success starts. And from ground zero, Mercy is also building success. All 5 Mercy hospitals in the St. Louis region received national recognition for stroke care from the American Heart Association. Elizabeth Schelp is the stroke program manager for Mercy Hospital South.
Really being kind of the point person for if we see areas that we can improve.
Her role in the St. Louis area is critical because in the U.S., every 40 seconds, someone is having a stroke.
Definition of a stroke is that you have lost blood supply to a portion of your brain. So with that comes oxygen and nutrients that your brain tissue needs to function and stay alive. They can get blocked by a blood clot in the artery, and so those are called ischemic strokes. Sometimes people form clots inside of their brain. Sometimes clots are formed elsewhere in the body and then travel to the brain and lodge in that vessel and block the blood flow. So once you've blocked the blood flow, that's when you start seeing brain damage occurring. So for every minute of a stroke, there's upwards of 2 million brain cells that could be dying.
The sooner a medical team can intervene, the more quickly the patient receives a drug or device, limiting damage, reducing disability, and ensuring a better outcome. Experience, collaboration, and following research-based guidelines matter when it comes to providing timely and safe stroke care.
Mercy South has a stroke team that's here 24/7, so they're all critical care, ICU, stroke-trained nurses that will see the patient as soon as they arrive, and that way we can really get all the images done, all the consultations with the specialist done, coordinate between the emergency room, the ICU, the interventional suite. It happens really fast. So that nurse in that role is really pivotal. They really do help our times and our metrics be the best that it can be.
Nationally recognized, Mercy Hospital St. Louis and Mercy Hospital South earned the highest additional designations for stroke care.
We all kind of help each other out with learning best practices.
With this commitment to high-quality stroke care, Mercy South is a Joint Commission Comprehensive Stroke Center.
So we're constantly looking at what are our processes really from the start of care, which is EMS. So making sure EMS has all of the newest research, newest guidelines, training to when they get to the emergency room. You have your acute treatments and time is brain.
And Kimberly says it shows in every aspect of her mom's diagnosis, treatment, and every level of care, including the care Lana provided them.
When she walked in that room, you could feel the love and the aura around her. She